Hi, I am Taro Naruka, and in this video I am going to describe you about what are the causes and symptoms of prediabetes. Diabetes is potentially preventable by changing your diet and being more active. Risk factors and bad habits once acquired may not be easy to reverse, but gradually boosting your fitness, metabolism and regular use of safe herbal supplements like Arab Research Foundation's Diadco capsules can delay the onset or absolutely cut down the risks of diabetes. Stress can have a direct impact on your health, leading to obesity, BP, cardiac problems and diabetes, the silent killer. Try preventives and natural therapies like sandalwood, lavender oil in your bath, soak, last wash, 10-15 minutes of deep breathing exercises for the added supply of oxygen, which in turn helps release feel-good hormones. Daily yogasanas like Salambhasavasana, Virasana point to ward off the perils of stress. Hormones produced by pregnancy-related factors and the placenta trigger insulin resistance in women during their late pregnancy stages, thus increasing the quantity of insulin required to control blood sugar levels. If the beta cell dysfunction of the pancreas does not produce enough insulin, gestational diabetes sets in. Women with gestational diabetes are 35 to 60% more likely to develop type 2 diabetes 3 to 20 years after delivery and should be persistently tested for prediabetes 6 to 10 weeks post-delivery and every 2 years thereafter. Inherited genetic mutations predispose individuals to diabetes, as is evident from its higher rate of occurrence in people with Klinefelter syndrome, Down syndrome, Turner syndrome, hemochromatosis, cystic fibrosis, etc. Other occasional but feasible causes of prediabetes include pancreatitis, trauma, cancer, all harming the beta cells of the pancreas or impairing insulin production and causing diabetes. Endocrine diseases like Cushing's syndrome, acromegaly, glucagonoma, rare tumor of pancreas, hyperthyroidism also cause elevated blood sugar levels. According to UK researchers, after analyzing 22 studies involving thousands of patients on antidepressants, people who take antidepressants are at increased risk of type 2 diabetes. The reason may be the weight gain in people taking antidepressants, as reported in Diabetes Journal. Scientists opine the drugs may be an independent risk factor with long-term side effects, themselves interfering with blood sugar control. Doctors should keep a closer check for early warning signs of prediabetes in patients who have been prescribed these drugs. Certain viruses often inducing susceptibility to type 1 diabetes are cocciquevirus B, adenovirus, cytomegalovirus, rubella and mumps. Binging on plentiful high-calorie foods leaves a person more vulnerable to prediabetes. Relentless research by its manufacturer has led to the advent of Diadco capsules in the alternative medicine and natural supplementation forefront to rectify complicated mechanisms which damage the beta cells, thus preventing various kinds of this dreaded disorder and improving its treatment. High blood sugar is like a soda pill on a countertop. It permits plaque-forming material to fasten more easily to artery walls. It's also one of the symptoms of prediabetes, which doubles your risk of heart disease or stroke. High blood sugar leads to symptoms of complications such as excessive thirst or hunger, chronic fatigue, vision loss, headaches, increased susceptibility to diseases, dental disease, aging, pregnancy problems, muscle, joint pain and inflammation, depression, palpitation, etc. Though not certain what exactly among these contributing factors starts the prediabetes processes, symptoms of the full-fledged disease develop gradually and sometimes go unnoticed due to their subtleness. However, regular intake of Diadco capsules before heavy meals daily can reduce the drug dependency of the pancreas, control sugar level fluctuations and prevent the progression of prediabetes to diabetes. Buy Diadco capsules from worldwideweb.dharmanis.com.